My grandson had surgery a couple days ago. Went to the hospital. And I know a lot of times you don't get the teaching and education that you should as far as your discharge planning. And I don't know if it's the steroid part or if it's the tonsil and adenoid part. All the parts. There's no teaching. This baby's supposed to be drinking every 2 to 3 hours. Really drinking constantly, because the drier it gets, the more painful it is. He's supposed to, have ice chips, things that'll soothe his throat. He is supposed to be monitored as far as like his behavior, because the steroids really make it hard for you. And so steroids change your behavior. Steroids change your thinking. Steroids change your attitude. You do things on steroids that you would not do if you didn't have them. Then there's another factor that plays into this, is other medications that have to work their way out of his system that interact with the steroids. Every medication that you get in the hospital is not out your system. It may take 30 minutes to act, but depends on the half-life of the medication. It could be up to 2 or 3 days before it all get out your system. And so, I don't know who I'm perturbed with, but I just feel like they got the short end of the stick, because it's not enough to tell someone that as long as they're drinking, they can go home. If you don't tell them that they're suffering, literally suffering, because of the incisions and because of the being intubated, because your throat is painful. And it bothers me as a nurse. It bothers me as a grandmother. It bothers me, and I'm up this morning, I'm doing a video with no makeup. It bothers me that somebody let a child go home without proper teaching, without the parents receiving proper teaching. I don't know. So if your child has adenoids, tonsils, whatever removed, if they have any surgery where they're intubated, no, it's going to take 3 to 5 days for their throat to just stop feeling painful. It's going to take 3 to 5 days, and pain management. If they prescribe them pain medicine, whether it's Tylenol, ibuprofen, and they say every 4 to 6, go every 5. With the child, you have to listen to them. You have to listen to the child's behavior. If the child's moaning, he's hurting. Try ice if it's between the pain medication, whatever else. Try popsicles. Try anything oral soothes the throat. If it's cool or like pudding, or have that, consistency. You have to, patients need the teaching from the nurses. You can't discharge a child out of the hospital and don't give the parents proper teaching, because they're like, oh no, he shouldn't do this, he shouldn't do that. You don't discipline a child when they're on steroids for how they're acting or behaving. You gently take their hands, fold them, because they're jittery and they gotta go. You gently take their hands, you fold them across their chest. You gently take your other hand and put it over their legs, and this is to calm them and to soothe them. And you say, and you tell them, calm down. We'll just say the child's name is Bob. Calm down, Bob. Everything's going to be okay. Just relax. Take a deep breath. Nursing interventions is things that you do when a child is just bouncing off the walls, whether it's from medications or from what have you. But I just want y'all to know that anytime a person is intubated, their throat is going to hurt. Generally, they give them the throat spray, Things that soothe the throat will be ice. Anytime a person's on steroids, their behavior, their attitude, their actions is not normal. You can't hold somebody responsible for action that they do while they're on steroids. Basically, they wouldn't do that if they weren't on the steroids. Anytime somebody is moaning or having problems in the middle of the night, after they've had surgery, That's indications for a nurse or for a parent to, go and offer something to drink. Keep a tub of ice, chips, or something at the bedside. All those are nursing interventions that should have been discussed with my daughter before she even left the hospital, and my son-in-law. So it disturbs me that the level of patient teaching that they were given, or should I say not given.